Want something that is not just interesting but also helps you retain and recall? Our videos are the perfect tool. Mandible, the dynamic jaw. It comprises three main parts: a horizontally oriented body and two vertically oriented rami. This configuration gives the mandible its characteristic structure and functionality. The body of the mandible, with its U-shaped design, presents the external surface, the internal surface, the superior border, and the inferior border. The superior border of the body, known as the alveolar process, contains sockets for the lower 16 teeth. On the other hand, the inferior border or base of the mandible exhibits a slight depression called the Digastric fossa on either side near the median plane. The outer surface has the Symphysis Menti, a faint median ridge that marks the fusion of the two halves of the mandible at the age of 2 years. Extending below this, a triangular elevation called mental protuberance forms the point of the chin, with the mental tubercles on either side. The inner aspect of the Symphysis Menti possesses 4 tubercles, known as Genial tubercles or mental spines, arranged into upper and lower pairs. Moving on, the mental foramen lies below the interval between the premolar teeth, providing passage to the mental nerve and vessels. Time for some fun facts. Did you know we have hundreds of such videos, mind maps, and notes? Go on, download our app and get access now. The oblique line, an extension of the anterior border of the ramus, runs downwards and forward towards the mental tubercle. Additionally, an incisive fossa, a shallow depression, is located just below the incisor teeth. On the inner surface of each half of the mandible, you will find the Mylohyoid Line, a prominent oblique ridge that runs downwards and forwards from behind the third molar tooth. Above the anterior part of the Mylohyoid Line, there is a shallow area called the Sublingual Fossa, housing the sublingual gland. Similarly, below the posterior part of the Mylohyoid Line, the Submandibular Fossa forms a slightly hollowed out area that lodges the submandibular gland. Now let's discuss the muscle attachments on the body of the mandible. The buccinator muscle arises from the oblique line below the 3 molar teeth, while the mylohyoid muscle originates from the mylohyoid line. The genioglossus muscle arises from the superior genial tubercle, and the geniohyoid muscle attaches to the inferior genial tubercle. The anterior belly of the digastric muscle emerges from the digastric fossa, on the base of the mandible near the Symphysis Menti. Finally, the platysma muscle inserts into the base, and the superior constrictor muscle arises from the area above the posterior end of the mylohyoid line. Intrigued by this video? Want to learn more? The full video is waiting for you on our app and website. Head on over there now.